What critics are saying about a new routine that keeps some of the state's worst mentally ill patients locked up in solitary confinement cells for 18 hours a day. But there's not a lot of sympathy for the group. They're the inmates of one of the country's highest security jails, Long Bay. And why should any of us give a damn about the comfort of the murderers and other criminals there? Well, the longer lockdown has been introduced, at least partly, because it makes staffing the prison hospital cheaper. But Australia's peak mental health organisation says it's a false economy and it's demanding immediate improvements.
Hello, Britt speaking.
The man at the other end of his phone line is articulate.
We are a proud nation, proud citizens of a civilised country.
He's apparently well educated and rational.
Over $3,765 a week. New South Wales and Australian hard-working taxpayers are paying for every patient and inmate in Long Bay Hospital.
He's also criminally insane and he wants your help.
They are turning us into zombies.
The state's worst psychiatric offenders are housed in the hospital at Long Bay Correctional Centre in Sydney. Many have committed horrible crimes, including murders and sex offences. But as forensic patients, they've been found not guilty due to mental illness. It's a high-security facility, and until recently, the inmates were locked in their cells at 9 o'clock every night. But in April, their routine was brought in line with the general prison population, forcing them into their cells just before 4 o'clock in the afternoon. That means mentally ill patients now spend around 18 hours a day in isolation, and they don't like it.
It makes you feel frustrated, outraged, angry and depressed, which is not therapeutic.
Do you have a sort of sense of, claustrophobia?
I have. For the first time in my entire life, I've been placed upon my request by the doctor on Valium because I have claustrophobia, and without some medication such as Valium, I wouldn't be able to cope with 18 hours locking in a solitary confinement.
Advocates for the inmates say cost-cutting is to blame. Locking them away for longer means fewer prison officers are needed.
So what have you got in your cell at the moment and when you're locked in solitary confinement?
6 concrete walls plus a couple of boxes which I have my legal documents and clothing in it. Basically, there is nothing, absolutely nothing, except, of course, there is a toilet and a sink.
Many of the inmates have signed a petition saying their human rights are being trammelled.
It's a very, very long time to be in a cell by yourself and with delusions and all the other problems. No, there's no question that what they're complaining about is occurring.
But a lot of the people who are in the hospital are there because they've committed some pretty awful crimes. Why should we care about their comfort?
They're human beings. These are citizens. These are people who have not even been convicted of the offence for which they were charged, and some of them have not even been charged. Now, these are people who are the most vulnerable of our citizens. So if we as a community don't show them compassion, it says something about us as a community.
And those who work directly with the inmates agree.
Anecdotally, there's been more increase in incidents of aggression around locking down and opening up times. Patients will become frustrated, banging on doors, shouting through the windows. The sheer frustration of being locked in for so long. It's especially when patients have other symptoms. They may be suffering from internal voices, so auditory hallucinations.
The nurses say under the circumstances, rehabilitation of the patients is impossible.
It's not just a matter of giving patients tablets and expecting them to improve. That's a small part of mental health treatment. Social interaction and mental health assessment is a huge part of those therapies, and they go hand in hand.
So how do you feel?
Nurses are expressing a lot of frustration around this. It's very difficult seeing a patient you've known for maybe months or even years to deteriorate significantly and be unable to intervene in those situations. To deliver care through a locked door isn't easy.
But you do have access to the patients after the lockdown though, don't you?
We'd have to alert officers to come down that we needed a cell door opening. We'd have to maybe phone another ward.